I was always really good at school, but I was good at a lot of different things, and I didn't really have like one thing to focus on, but I didn't want to do something where I didn't talk to people. So I went to UNC, and there was a pediatric rheumatologist there, and I did an elective with him. And I thought, well, this is really interesting stuff. I do specialize in a couple of things. I've done research in dermatomyositis over the years, which is like an inflammatory condition that affects both skin and muscle. So kids get weakness and rashes. I like to take my time with patients. I like to get to know them as much as like what's been going on. The nice thing is that we're given like an hour with new patients so that we can get the whole story. Look at the labs that have already been done, look at the imaging that's already been done, like get a real sense of what the issue is and try to sort it out. And sometimes these kids need more labs, they need more imaging. Sometimes they just need someone like to go through everything that's been done and say, well, this seems reasonable, or, maybe we would consider doing something different. I try to always, if they're verbal, ask the kid, why do you think you're here today? And, the older kids generally know. The younger kids, sometimes they just giggle and they're like, I don't know, Mom. And so someone hopefully like answers why they're there. But I usually ask the kid to identify themselves, and ask them if the person in the room with them is their parent, and try to get them to talk as much as possible. Sometimes we have to try different things, but we have such good medicines these days. We're able to make most kids significantly better to the point where, you don't know that they're sick unless they tell you. Kids are fun to talk to. They have a capacity to get better. You can make a difference in their life early on that stays throughout their adulthood. You can help them become productive members of society.